Hello, Mountain House. Welcome back to Mountain House Health Matters. I'm Bryan Harrison. I'm your host for this episode here and publisher of Mountain House Matters, your now weekly community newspaper that reaches everybody every week. Subscribe if you haven't already to make sure you get it every week. That's my little plug for today. We're here today with the dynamic duo of Dr. Chitta, who's a pediatrician with Pearl Pediatrics, and Dr. Chitturi, who is at the Assure Primary and Urgent Care here in Mountain House. They also happen to be married. So they make for a great team. So today we wanted to bring a topic with the upcoming season of swimming and camping precautions. As families spend more time outdoors during the warmer weather, what we want to do is look at some of the big health concerns that might arise. And I want to welcome both of you. Dr. Chitta, thank you for being here today.
Pleasure is ours, as usual.
And Dr. Chitturi, always a pleasure. And I think what I'm going to do, as we did in the past episode, is to have you've got a whole list of questions going there, and I think you're going to facilitate a lot of that.
Yes, so. we have a topic ready. So, hi everybody. Today we have a very interesting and very good topic, which is more appropriate for this time. This is regarding to the safety precautions and what we need to look out for in times of while swimming or while camping. So Dr. Chitta, our subject expert, will throw some light and give us some education on these matters. Hi, Dr. Chitta. Welcome.
Hello. Hi, Dr. Chitturi. Hi, Bryan.
Dr. Chitta, thank you.
All right, Dr. Chitta. So this time of the year, we see all kids going out to the pools and ponds or lakes and all. So what precautions do you advise to their parents when kids are in the pool or in the water bodies?
Sounds very appropriate for the season. That's a very wide topic, so it depends on the place where we are going, like what kind of water body the children are being around. No matter what kind, no matter their age, no matter the ability of the swimming level, always have the parental supervision. Some say, okay, I'm having my children learn the swim classes, they're very good at swimming. That's fine, they can swim over there and we're having some barbecue on the side.
Don't have to worry about it.
No, not like that. We always have to have one designated adult supervising the children, constantly eye on the kids in the water. If it is the older children. If it is toddlers, the young children, I advise hand reach distance. So the adult has to be in the water within the reach of hands. Why are we doing all this? Because we are worried about drowning, right? Drowning happens very suddenly and very quietly actually. It's not loud. You don't hear it while it is happening or while it is happening, unless we are having that eye on it. We call it as designated adult watcher for water bodies. When there is group of adults, we think like, oh, somebody else is watching, or oh, we're all watching, and we tend to get distracted with something, food, water, cell phone, anything. When a designated adult is assigned, they have to be avoiding of all these distractions, and whenever they need the break, they need to assign somebody else for that constant supervision. That is the first most important thing.
So maybe create a shift schedule of some kind.
Right, exactly.
And probably those adults should be the one who knows swimming.
Right? Swimming helps, yeah.
Swimming helps, because they need to swim.
Like a lifeguard.
Lifeguard or somebody.
Yeah.
Okay.
Surprisingly, a lot of these drowning accidents, drowning is one of the leading causes of death in children. And most of the incidents happen while under supervision. That tells us like how designated adults should be, like, because it can happen within a few seconds.
True. So, all these kids use floaties versus jackets, life jackets, to prevent drowning. Do you have any preference between floaties versus life jackets?
Good question.
Yes, yes. The floaties are just how to float, but they are not actually designed to keep the child up in the
upper level.
floating position always. They can make the child vertical, which can make them drowning in the time of accidents. So floaties are not life-saving. I do not suggest that. They are more like an accessories a little bit to play around in the not much depth in the water, again with adult supervision and within arm reach.
Okay. Is there any particular swimwear do you recommend for kids?
So that's a very good question. The swimwear, it has to be, I recommend doing tighter snug fit clothes, not having loose ones. The loose clothes can actually weigh down the child in case of drowning. So snug fit is better. If they are little longer length to cover majority of the body, to keep the body warm, it is better because
It's a good one.
especially in open water bodies like rivers and lakes, even though it is summer and the superficial water is warm, the deep water can be cold. What this cold water does is something called cold water shock. Even a very good swimmer, when they exposed to this cold water, it triggers one reflex that makes them swallow the water and cause drowning. That is why it's important to use to have this adult supervision and warmer clothes for that to avoid the cold shock. Also, in case of drowning, we need to, or when the drowning is happening, we need to be able to find the child easily. So it's better to wear more brighter clothes, neon clothes. Avoid blues and darker blues, blacks. Avoid those colors.
Yeah, especially in drowning, it's because water is going into the lungs and stomach. So that's something we need to be careful when you, especially when you're doing CPR, pushing on the stomach. Many people put pressure on the stomach after pulling the kid out. That can cause to aspiration, the stomach water coming out from the stomach into the lungs. So got to be careful.
So what would be the way to pull a kid out of the water?
May pull the kid out of the water, but don't press on the stomach and stuff. Do CPR on the chest, not on the stomach.
Oh, I see what you're saying.
Yeah.
And pull them out probably under their arms.
Correct. Right. Yeah. All right. So there's a common myth. People feel like lakes are safer than sea or beaches, lakes and rivers. What's your opinion on that?
Any water body will have much more risk for children. I would say it doesn't matter, lakes, rivers, oceans, beaches, irrespective of the currents. In oceans, there's a risk of getting trapped with the currents and getting drowned. So in such
Very real risk.
Yes.
Yeah, an undertow can take you away in a hurry.
In such situations, you don't want to swim. You want to float along with the current until the time somebody can come to rescue the child.
Don't fight it.
Don't fight it. In the lakes, you want to float again because when you get drowned, the cold water shock that I was mentioning earlier, that is a bigger risk in lakes. So you have to be careful. And I strongly suggest, even though the children can swim really well, it's better to have the life jacket in any kind of open water bodies, whether it is lakes or oceans. Only in the closed space like a swimming pool or backyard pool, things like that, I let the children swim by themselves. Otherwise, life jacket.
Okay.
Even then, you want to keep an eye on them.
Yeah.
Leave them to their own devices, totally.
Yes.
So moving to next outdoor activity that is commonly done is hiking. So do you have any recommendations of what kind of hydration and amount of hydration required while hiking, and also any recommendations on sunscreens that need to be used?
Very good. Again, season specific. Hydration. So a lot of people think that when it is hot and they think okay, drinking water is good, or people think, okay, I'm drinking juice all day, or I've been drinking coffee, a lot of liquid I'm taking in. They think, okay, I should be hydrated well, but it's not true.
Coffee doesn't really count, huh?
It doesn't,
Okay,
because
it's a
the
counter effect.
caffeinated products will actually diurese, so it will cause more dehydration to the body. So that does not count.
So true of energy drinks and that kind of thing
Yes,
as well.
because they always have, they are,
Lots of
most
sugar
probably
and
has
lots of
caffeine and
Any kind of
sugars.
caffeine, the way it makes you dehydrated is makes you pee more, and when it makes you pee more, you may feel more dehydrated. And you drink again in return coffee and stuff, so it makes you more dehydrated. It's like a vicious cycle. Yeah.
So the best hydration liquid during hot days is electrolyte solution. Any kind of electrolyte solution, whether it is powder form, liquid form, anything is okay. A lot of parents are also surprised when they say, oh, give them some Pedialyte or Gatorade when they are sick. They're like, oh, is it okay? Is it safe? Like, it is safe.
It is good, yeah.
Very young children can have electrolyte solution. According to parents' preference, any brand is fine. But they all usually have the same balance of the electrolytes. Drinking water alone will not help.
A Pedialyte would have the same as Gatorade? That wouldn't be
The
same,
sugar
right?
content is different.
Yeah.
Again, the brand to
But they
brand.
still have the-
Yes,
they still have the
there are
electrolytes.
LIV or Powerade. There are a lot of brands that are available. The sugar content is different. I would say less sugar, the best.
Generally, that's better, yes.
If you can
Yeah.
do sugar-free completely, that is best. But the electrolyte composition, the electrolyte means like the sodium, potassium, chloride, these electrolytes, that composition is usually standard among all the electrolyte solutions.
Good to know.
Those are the better hydrating solution.
What about the sunscreens and any age limit for or minimum age required for using the sunscreens?
The sunscreens can be used starting 6 months of age. And I do recommend using sunscreens every day, irrespective of season, winter, summer, you're going hiking or not. Even if you're staying indoors, always have to have sunscreen every day.
Indoors as well.
Yes. The indoor
Indoors.
light also can cause UV radiation, skin damage.
Really?
So you want to be protected.
Wow.
Sunscreen
So
always.
these lights, we should have sunscreen on.
Yes.
You probably do.
Right. The sunscreen again has to be reapplied. The sunscreen needs to be reapplied every 1.5 to 2 hours. Usually the package will say how many minutes it is safe. If you are going into water activities, you might have to
More
do
frequently.
both water resistant and more frequent application. The reapplication is the key to prevent skin damage.
So commonly we see ticks, especially when hiking or camping, ticks on the pets or ticks in your hair. So what do you suggest to your patients if they see a tick on them? What is the first thing they need to do?
Okay, first I would say protect. Prevention is always better than cure. When you are going into woods, always wear full length clothes as much as possible. If you also use the bug repellent to avoid the ticks or any other bug bites. There are a lot of bug repellents. Which ones to use is the question, right? The most effective ones are, the medically proven are the ones that contain DEET, DEET. DEET, it has to be at least 15 to 20%. That is most effective to prevent the bug bites.
Is that at all harmful to the person applying it to their skin?
It is safe. Even for kids also it is safe in those concentrations, as long as you're not inhaling them. It's applied only on the skin, exposed parts of the skin, and also a little bit spraying on the clothes also will prevent attracting these bugs and ticks. The other thing is, if, like you mentioned, if you are worried about chemicals, there is a natural one called Picardin. It is a plant product. Picardin is also as effective as DEET. But a lot of products, they don't say in the name of that The same brand will have multiple products, so we have to look at the label, choose either the Picardin or DEET.
Reading labels is generally a good practice, regardless of what you're purchasing.
Yes, those two will prevent it. If you happen to have a tick, do not crush it, do not try to smash it. Use the tweezers. Take tweezers and hold the tick at the base of it, pinch it and take it out. After that, get a doctor's consultation regarding that. In some areas, the ticks can transmit some of the diseases, and these symptoms you may see like a little rash in the tick bite area, or any other parts of the body also can have a rash, and people can develop joint pains as well. And these symptoms may develop few weeks after the tick bite. So be cautious.
And Lyme disease, is that what
Yes,
constitutes?
it is a Lyme disease.
I've heard that you can heat up the tweezers that you're using if you burn them, or is that just to sterilize it?
No, do
Don't
not
do that.
burn.
Don't do
not
that.
burn that.
You don't want the tip of the insect left in the skin. You want to pull it out.
You want to get the whole guy.
Yes. If you burn or crush it, the toxin will actually go into the body and
so
cause
don't
more
do that.
problems. So don't do
I
that.
think we have a question from the audience.
Yeah, so if there's more than 20% of DEET in the skin,
Bug spray.
The bug
the bug
spray.
spray,
Mhm.
is it okay?
It is okay to repel the bugs, but it can, because it's a chemical, sometimes inhalation can cause some adverse reactions. So we have to be careful.
So maybe wear a mask if you're going to do a heavy dose,
Stronger
or-
bug spray.
Stronger bug repellent.
or don't breathe.
Yeah, I
Friendly.
usually advise turning the face to the side and spray on the rest of the body.
Okay. All right. So next.
Good question.
During a campfire, do you have any specific suggestions on the precautions to be taken to handle the fire in the
Yes.
campfire area, like from burn injuries or?
Right, yes. Yeah, children need supervision always. Just like water bodies, always have a designated adult to watch the children around the fire. Make a little perimeter and do not let children cross that perimeter going near the fire. Sometimes with the wind, the fire can blow away and cause danger too. So I advise keeping a first aid kit always when you're going to the camping. Always keep some band-aids, some cool packs, and the first aid kit so you can treat it right away and get medical attention afterwards.
That's a good point. Yeah.
Would you include EpiPens in that too, or only if people are already diagnosed with sensitivities?
Yeah, EpiPen is only as a prescription given to with the known allergies, severe allergies, not like the regular
Not like
normal
poison oak or
rashes,
something.
things like that. I would advise keeping the Benadryl handy because of the allergens exposure risk during camping.
So, other thing I have noticed is while setting up the tents, many people use nails which are rusty, and they get wounded because of these rusty nails. So we should make sure that they are properly immunized. They are up to date on their immunizations, especially with the tetanus shots and all. When they are handling rusty nails, it can be anywhere between, if they are not vaccinated, between 5 to 10 years. They need to get a booster.
That's a good point.
And also the nails can cause wound infections. There might be antibiotics and all. So just if they are rusty, get rid of them and get new nails. Right. All right. So before we end, I would, if there is any insect bite while camping, is there any simple tips for parents or people to follow to avoid aggravating the bite
Okay.
into a bigger infection or bigger wound?
Yes, that's a very good question, just like you mentioned about the first aid. Cleaning the wound with mild soap and water immediately. That gets removed any of those insect secretions that could be carrying some bugs. And also having an ice pack to cool down the wound that will help reduce the swelling. if there is any acetaminophen handy that can help with easing the pain.
It's Tylenol. Yeah.
Tylenol as the
Tylenol or ibuprofen. Yeah.
Yes, something like that to ease the swelling and pain. Also having an antihistamine or Benadryl, the life savior.
For certain things, not everything.
Yes.
Not breathing issues.
Exactly. Yeah. So the bug bites can be painful and they can cause significant swelling. So you having these first aid medications handy will help with treating these unexpected situations.
And what's your position on when you're having a campfire, whether or not you should have s'mores?
Just
No sugars.
Come on, we're camping.
Yes, yeah. But be careful keeping the distance.
Don't overdo it. Yeah,
With the sugar.
that's true, because if
With the
they're
fire.
toasting the marshmallows themselves, you do have to have parental supervision.
Yes.
Right. Yes.
The kids get more excited with the s'mores. You just need to control the excitement.
All right. Well, I want to thank you both for your wealth of knowledge, and I appreciate your perspective
Thank
and
you.
helping to guide us along here. You've been watching Mountain
Thank
House
you.
Health Matters with pediatrician Dr. Chitta, with Pearl Pediatrics, and Dr. Chitturi from Assure Primary and Urgent Care here in Mountain House. Thanks for joining us. Please like and subscribe and share with your friends, and give us some comments. We appreciate the feedback. And come again. We'll be back with more episodes coming soon.
Thank
Take
you.
care.
Thank you, Brian.
Thank you.
Thank you both.